Telemedicine has exploded in popularity during the pandemic, and we're not just talking about humans.
So pets are also getting to meet with their vet virtually. Joining us live to chat about virtual vet visits is Dr. Eric Ruhland from the St. Paul Pet Hospital. Good morning.
Good morning, Alex. How are you doing?
We're doing well. How do you get your pet to, work on the mouse? I mean, is that that's a skill that, in the Zooming, you just got to get in position and not to, do what they usually do, which is lick their whatevers. All right.
I like to coat my mouse with peanut butter for butter. She usually would do that. That or the hot Cheetos would probably work perfect too.
The hot Cheetos.
Can't go wrong with hot Cheeto.
So pets now have more options, or pet owners they're family, right? When it comes to telehealth. So what are they?
So right now, it's important for everybody to understand that what doctors can do is sort of limited to our relationship with our client and with our patient. And so according to the Board of Animal Health, and I don't want to get too heady in this and I don't want to get too far, but it's important for everybody to understand that chiropractors or veterinarians or dentists can only do the certain things that are allowed within the Practice Act by each state legislature. Again, I'm not going to get too heady or too far into this. But I, as a veterinarian, can only prescribe and diagnose a patient that I have a relationship. It's called a valid client-patient relationship. It's very, very important, and we have to establish that relationship every year. Through COVID, though, and because of the availability of in-person visits, and of course that was a big challenge. The Board of Animal Health started to relax a little bit of our virtual appointment requirements for these relationships, and so now veterinarians can actually give recommendations to people that are maybe not a prescription or a diagnosis, but I can, as a clinician now, without a relationship to you, I can give you veterinary advice or tele-advice as a doctor. And that's really, really important because a lot of times my clients are calling in and saying, hey, Dr. Eric, is this an emergency? Or, my dog's had a fever for, 2 days. Is this something that needs to be seen right away? Or my dog has puked one time. Do I need to go to the emergency clinic right now? A lot of times that connection, getting that connection or making that connection closer with our clients is really helpful virtually. So beyond that, I know a lot of hospitals have been rolling out full-blown telemedicine appointments, like for behavior, dermatology things, allergies, where we can do that appointment virtually. We can look at maybe the lesions, or I can look at the dog. And our hospital's been doing that for a while. A lot of practices have been rolling out actual telemedicine appointments where we'll prescribe and diagnose. That's a little bit different than this telemedicine sort of brief, let me tell you, or you can tell me what's been going on, and I can give you advice, but I can't necessarily give you a diagnosis or prescription. Does that make sense?
Mm-hmm. Absolutely.
Okay.
Super helpful for a lot of pet owners too. But obviously you can't diagnose everything or prescribe everything over virtual visits. What are some things for pet owners that are a little maybe more useful, and then something that you have to actually go in person to see?
The things I think about, so the things that we do really commonly are derm appointments, behavioral consultations. There's things from ophthalmology. There's a lot of things we can do virtually, but when I need to get a physical biopsy on something, and I would say probably a third of my clients that I'm having a virtual appointment with, I'm going to say, hey, I'm going to need you to come in for some blood tests, or you know what, that might need a biopsy, or I need an x-ray of something. This cough is persisting for longer than a week. I need you to come in and get x-rays taken. So there's an understanding that there's a limitation to what we can do, but it's actually surprising how many cases and how many things we can see at home, especially those really ornery cats that don't want to come into the care, don't want to get in a carrier, don't want to go in a car, the dog that gets super anxious when they come in. Some of those patients, those are great virtual appointments that we can see or telemedicine-wise.
Okay, and finally, severe weather season. We know it's here, and not all pets do well in that situation. How can we keep them calm?
So getting them a space that's downstairs in the basement, dogs and cats alike always want to try to get underneath something in severe weather. So the storms that we had recently, my dog was pacing constantly. I have a kennel downstairs in the main floor. It's got a lot of blankets over it. She likes to go underneath there. And then talking to your veterinarian too about what medications might be good for anxiety. There's drugs that are really good at calming these, at situational anxiety, and your veterinarian's going to know that. And some of these patients might need to be medicated. But again, giving them the space to get underneath, giving them a safe spot, and making sure that they have a place that's there all the time, not just during a storm, and they need to know that it's there.
Okay.
Wonderful.
We love your pup.
So cute.
A liquor.
Butter is upset because she's not had her breakfast this morning, and so she behaves a little bit better when I know I can at least keep her attention.
Oh, okay.
She's waiting
That's
for
the
something.
Once
key.
she has breakfast, she's going to pass out. She's just not.
All right. Thank you, Dr. Eric Ruhland from the St. Paul Pet Hospital. Thanks for joining us. For more information, head to stpaulpet.com.